Okay, the meeting is now live streaming and it'll
Thank,
be recording.
thank you. Good afternoon, everyone. I would like to call, that always messes me up. Good afternoon, everyone. I'd like to call this Health and Human Services Committee meeting to order for Wednesday, June 16th, 2021. Can we have a roll call, please, Madam Clerk?
Calling the roll, Ms. Conwell,
Present.
Mr. Sweeney,
Present.
Ms. Brown. Ms. Brown is absent today. Mr. Miller,
Here.
Ms. Stevens,
Present.
we have a quorum.
All right. And I know we do not need to excuse committee members for are missing, but I'd just like to put it on record that Councilwoman Brown did call in advance and she had a prior engagement she couldn't get out of. Madam Clerk, is there any public comment?
No, Madam Chair, no one submitted any public comment.
All right. We have the minutes from the June 2nd meeting before us. Can I have a motion and a second to approve the minutes?
So moved, Dale.
Okay, moved by
Second.
Stevens and seconded by Miller. All in favor, please say aye.
Aye. Aye.
The minutes for the June 2nd meeting has been approved. We have one item that is referred to us today. I believe we have Paul Porter in attendance, as well as Director Tracy Mason of the Department of Senior and Adult Services. So Madam Clerk, if you could please read that item into the record.
Resolution number 2021-0151, making awards on requisition number 4919 to various providers in the total amount not to exceed $6,800,435.60 for various services for the Cuyahoga Options for Independent Living Services program for the period July 1st, 2021 to December 31st, 2022.
Mr. Porter, I know you're going to give us the contract background. Could you allow Executive Director Tracy Mason to give us a little background on the options program? Do you mind?
Absolutely, that's perfect. And I think Director Mason is joined by a couple of her staff members, Cynthia Mason from the Options Program and Darlene Wade, one of the Deputy Directors at DSAS. If you guys have any additional programmatic questions as well, would you prefer to hear about the program side first or more about this contract item to kick us off?
If she could give us a little background on the options, we do have new council members, just so and then when they hear the contract, maybe it'll all flow a little better. Thank you.
Thank you.
Director Mason?
Yes, absolutely. Happy to give an overview. Our Options for Independent Living program, I mean, the name of the program is truly what it is. This program have been in place for about 20 years now. And this program is identified for individuals who income may not meet passport or Medicaid waiver requirement, or the illness may not also be within their spectrum to receive those services. And so our Options program was invented to provide those services to those individuals who still needed that additional support. And so it is on a sliding fee scale for many of our clients who may be in need of, whether it's home delivered meals, homemaking, personal care, chore services, as well as emergency response. We have a team of social workers. We've just been able to add a couple more staff. So we have about 16 social workers, couple supervisors, and a director of our options program, and our clinical deputy director that oversees the options program. And we also contract with a host of providers to provide those services that I just referenced. And so our team does all the case management services. They conduct the home visits, they do the assessment, they coordinate the care between the client and the provider to make sure their needs are met. And I say that, you know, we get so many positive responses from the clients who use this program. This is a program that we do not heavily advertise, primarily because, you know, we don't have the supply to meet the demand. And so we're just happy to be able to serve those who need us. And in 2020, we served nearly 2,000 clients, which we were thrilled to be able to eliminate our waiting list. So prior to the 2020, we were at 1,700. So we were happy to be able to remove 300 people from the waiting list. So that's a big picture overview of the options program.
Thank you. Any questions from Director Mason before we go into the specific contract, or you could save them for later? Let's do that. Mr. Porter, if you can dig into this specific contract for us.
Absolutely. Thank you, Councilwoman Conwell. So this is a presentation of our award recommendation for a new 18-month contract for the options program extending from July 1st of this year until 12/31 of next year. This contract further contains an option to extend the master agreement for one additional year from January 1st of 2023 through December 31st of 2023, based upon the DSAS program needs, how the providers are performing, and the availability of funds. We issued an RFP for this contract, and this award is a recommendation based on the proposals we received for that RFP. The RFP closed on March 25th of this year. There were 25 responsive vendors, of which 24 are entering into this master agreement. There was one vendor who we recommended for award, and they ended up opting out of the process and didn't move forward with the contract. That was Ace Taxi. And then there are two additional vendors who are current options providers and weren't able to submit a proposal in response to this RFP. We requested an exemption, which was approved by the Board of Control at last Monday's meeting, to add those vendors to the master agreement. And those vendors are Honor and Compassion Home Care, and then GeoCare. As Director Mason indicated, this contract serves the entire county, and those two vendors in particular serve clients that are located on the west side of the county, which historically has been the harder to serve area of the county, considering eligibility and service areas for these vendors. There are a number of vendors that are being added to this contract versus the number of vendors that we have under contract right now. There are going to be 6 total new vendors for this contract, and that leaves us with a total of 27 vendors delivering a variety of services. Director Mason indicated what some of those services are, everything from home delivered meals to homemaking and personal care, as well as emergency response services like the button a client can press if they're having an emergency at their home, and then medical transportation. The value of this contract is $6.8 million for that 18-month period. And if we look at that separated out for the remaining 6 months of 2021, we're looking at an approximate cost of $2.2 million. And then for the full year of 2022, we're looking at an approximate cost of $4.4 million. That does represent a substantial increase from the last full 12-month period, which would have been during calendar year 2020, when the amount of funding was $3.6 million per year versus $4.4 million. That's reflective of the additional funds that were included in the biennial budget for the options project, reflecting the level of priority that this program has for not only the Division of Senior and Adult Services, but for County Council as well. Again, this program serves the entire county. Director Mason indicated that we do not currently have a waiting list for services right now. The only time we run into issues at this point based on the level of funding is making sure that a provider has a staff member that is able to accept a referral when we send somebody over. By adding these new vendors in, again, we hope that addresses any capacity issues that might arise. And we've got new vendors in several different areas, including the homemaking and personal care, the transportation area, and then that emergency response service area. I don't necessarily have a lot more detail about the contract itself. This one's fairly straightforward. Again, we're making an award from the RFP. We have the 2 vendors that we're doing an exemption for, and this is 18 months versus the 12 months that we typically do, just so we can get it through the full calendar year next year.
All right. Thank you, Mr. Porter. I'd like the record to reflect that Councilwoman Brown has joined the meeting. I just have a few questions. The age range of the citizens that are utilizing these contract services right now, what is that?
Sure, it should be 60 and over or 18 to 59 and with a disability. So it's not necessarily restricted just to seniors. Adults with disabilities can also access this program.
Thank you. And you had answered my first question, were any of these new? Because new providers, and I thought so. If you could just send us a list offline, which ones we could, to identify which ones are the new ones.
Absolutely. And do you want me to
contract.
go over that right now, or is that okay to send afterwards?
You can go over it. I don't think it'll be long, but please send it anyway.
Absolutely. So Caring Hearts and Evolving Nurse are 2 new homemaking and personal care agencies. Healthy Home Care Transportation and We Put Family First are 2 new transportation vendors. And then Connect America and VRI are 2 new emergency response vendors. I will note that VRI historically had been a vendor, I think 3 or 4 years ago was their last year under contract with options. So rather than being brand new, we would consider them a returning vendor after an absence from the master agreement. So those should be the 6 new vendors.
All right. And so that includes the GeoCare and the Honor and Compassion?
Yes, it does, because they're currently on the master agreement and they currently serve clients, which is why we pursued the exemption for those 2 to avoid interruption of services for the clients that they're currently serving.
All right. This is one of DSAS's biggest contracts, correct?
Affirmative. This is larger at this point than the Community Social Services Program, or CSSP. So this is the largest that DSAS has at the moment.
All right. And is there any relationship with the Greater Cleveland Food Bank and Harvest for Hunger network? And what is it?
Director Mason, I would defer to you to answer that on this question.
We do not have a contractual relationship with Hunger Network or the food bank for this program. We do know that some of our home delivered meal providers may contract with the food bank directly to provide those meals.
Okay. Thank you. I'm going to open it up to my colleagues for any questions.
Madam Chair.
Councilman Miller.
Thank you. I don't have any particular questions, just to say that I believe that this is a very important program that serves a lot of need out there in the community. And I think it is wise for DSAS to prioritize this program and wise for the council to strongly support it. Thank you.
Thank you. Councilman Sweeney.
Thank you, Madam Chairwoman. To Director Porter and Director Mason, it's nice seeing you. 3 very brief questions. One with Ace Taxi. Can you tell me why? I know the entity for a long time and just curious, instead of calling the individual, I'm just curious if you know why they may not have chose to participate.
Sure. Thank you, Councilman Sweeney. There were questions about increased insurance requirements, that they would have to seek a higher level of coverage than what they currently have. and kind of weighing that with what the volume of referrals would be, since they would be a new vendor for this program or a returning vendor after an absence, they wouldn't necessarily start with a caseload of clients. They would get referrals throughout the program year. The clients that are already enrolled in options, if they're receiving transportation services, are likely already receiving those services from another agency.
Got it.
I think it was just a question of whether they felt like the increased cost of coverage was worth it, given that they didn't know how many referrals they would get. I will note that we left them down as recommended for an award on the tabulation sheet. So we would reserve the right, if they come back to us and indicate that they want to join the master agreement, we would be able to add them by amendment if we still needed, additional capacity for that service.
You're pretty awesome with knowing every detail, because it was just basically a business decision on their end. And they're still in the mix if they want to come back after they do their own due diligence.
Absolutely correct. Thank you.
Okay, thank you. And number 2, Madam Chair, if I can continue.
Yes, sir.
Thank you. When you mentioned it's the west side was more difficult to serve or underserved, or is it because of just tell me why so I can have a better understanding of it.
Sure, I can give kind of a contractual opinion on that, and then I would defer to the DSAS team if they fill in the blanks at all. More of the agencies that tend to respond to this RFP are headquartered on the east side, and a lot of their staffing base is on the east side. Things that we've heard just anecdotally are that for aides who might not have a car and might have to take public transit to and from the clients' homes, the transit is not as readily available on the west side, particularly to some of the outlying suburbs. And we see that with some of the southern suburbs as well, like Brecksville and Broadview Heights. Additionally, there are questions about the cost of doing business or cost of compliance with this program. If agencies are more used to having private pay clients and just accepting cash payments for providing these services versus kind of going through the effort of submitting a proposal, meeting the various contractual requirements we have. I know there are a few large agencies on the west side that both Cynthia Mason and I have courted for a number of years to try and get their interest, try and garner their interest in applying. And they've simply said, we have enough cash business that we're not looking to put out a proposal and maybe get a chance for more clients. Tracy, I don't know if you or your team want to add any additional info.
I will ask our options director, Cynthia Mason, to see if she have anything to add to your explanation. Cynthia, can you turn on your mic and your camera, please?
Unmute. There. Yes, I think Paul said it wonderfully. That is the reason that we've been given, that they don't have the staff on the west side. Thank you.
Thank you. But do we have the need on the west side?
Yes. Yes, we do have the need on the west side.
Got it. And thank you, Cynthia, for jumping on. Just want to go a little bit. You said you had an opportunity to talk to 3 of the larger vendors that they said no. And from your and Director Mason's efforts, I'd be more than happy to jump in and tell them we have a need and how we can figure it out. I mean, if we have a need and it seems like it's stuck and and you've exhausted your efforts, it looks like it to a frustration level. I'm not big on taking no from when there's a need out there. And if we can't figure them out, how can we continue trying to push to take care of the folks that are in as much need as anybody else?
Thank
no
you.
matter where they live, as long as it's in Cuyahoga County, we got to take care of the folks. That's what we get paid for. Does that make some sense? I'm not pushing. I am pushing a little bit, but I'm trying to be a partner here.
Thank you.
If I could add a note to that, Councilman Sweeney, 2 years ago, we released an RFP in the middle of the master agreement specifically targeted at those western and southern suburbs. And we were able to add several vendors to the existing master agreement by doing that. Vendors like GeoCare and Honor and Compassion are some of those vendors that we were successfully able to get added to the contract. There are others as well that, due to kind of our targeted outreach, we were able to increase our capacity. So again, we're not to the point where we really have a waiting list any longer. At that time, we did have a waiting list, particularly for clients on the west side. So I'm pleased to say that our efforts have worked out. That's not to say that, more effort couldn't be helpful in the future. And we will continue to make sure, we reach out to all of those vendors when we put an RFP out. I mentioned that there were 25 responses. We notified 304 different agencies of this RFP. That's a much higher number than the number of vendors that might be identified for some of the county's other RFPs. And I think that reflects the work that was put into making sure we have a good vendor pool. We looked at vendor lists on the Ohio Medicaid system, on private insurers, vendors that do home care and home delivered meals from those lists. We tried to put together kind of cast as wide a net as possible. And I think that paid off with being able to add a couple new vendors this time around.
Absolutely. I mean, your team has done yeoman's work as in my early stages here, and you should get the kudos that you deserve. Just one more thought that came while you're talking about it. You're saying there's no waiting list, but then you said there's a need that's not being filled because there's no vendors. I'm trying to get my arms around that.
Sure. So that was just in the context of GeoCare and Honor and Compassion in particular. Those two vendors serve those west side harder to serve areas. And that's why we moved forward to include them by exemption, even though they weren't able to submit a proposal in response to the RFP. So it's not like there's clients waiting for services right now. My statement was more, if we didn't move forward with including those vendors, particularly GeoCare, which is headquartered on the west side in North Olmsted, I think we could run into kind of a shortage of available staff or capacity out that way.
Awesome. I have a fuller understanding now. You through your hard work and your team, crisis averted for now. Everybody's taken care of. We just got to make sure wherever the world takes us that we need some breathing room or some. We got it covered now, and we want to have a little bit more flexibility in the future or bigger pool to pull from.
Thank you. Yes, that's a great way to put it.
Okay. And Madam Chairwoman, just last question to Paul. Just on, if we get phone calls from our constituents and we say, oh, this is the identity, this is the place where we can believe they can have their needs satisfied. A list of all the vendors and the point people that deal directly with council people, or does it normally go through us calling you, or is it our staff from the council calling? Just the mechanism, how it's set up. I'm big on knowing who it is so I can go right to them and try to match it to make sure it works. So can you give me a little bit of how that works from your perspective?
Sure. Cynthia, I would defer to you to explain a little bit more about the options intake process. Councilman Sweeney, the clients don't necessarily get referred directly to those agencies. The referrals come through the options team and Cynthia's team in particular.
So that's how it would work. Okay.
Yes, they come to the centralized intake on the phone, and then they're referred to our program. We call the client directly and work with them over the phone, and then do a home visit and then get them set up for their services.
Got it. Because you'll understand their language a lot more than me. I'll get it. I'll hear it. I'll say, oh, I know where it goes, but they'll say, no, you'll understand exactly, ask the right questions and match them to the right resource that's available.
Yes,
I think we're going to get to know each other a little bit more than you probably want to, Cindy, but I'm going to give it a good effort. Thank you, Madam Chairwoman. I appreciate the deference in my questions. I believe they had all relevance to the topic.
For you, Councilman Sweeney, they did. Thank you.
Councilman Sweeney, just have them call us at 216-420-6700. And
But then I
we,
know they're in good hands. Okay, thank you.
All right. Are there any other questions from my colleagues? Okay, I don't see any. I just had one final question to Paul. Are there still any municipalities in Cuyahoga County that are not in the options program? I know before we farther out, the outer rings on the west side had some issues a couple of budget cycles ago. I just want to know where we are with it.
Councilwoman Conwell, thanks for your question. At this point, we have coverage for all services throughout the entire county. So there's not a single service that has a service gap anywhere in the county.
Okay.
and we have residents in every district throughout the county who is participating in the options program or have participated in the options program in the past year.
Okay, very good. Now this is related but kind of unrelated. Director Mason, have you heard any word of when the seniors will be able to go back to the activity centers?
Yeah, we do not have any specific dates right now. We are working with our senior centers on a reopening plan just to better understand what their needs might consist of. We have established a relationship with the Emergency Operations Center to make sure they have proper PPE available. You know, right now we're trying to better understand the testing requirements of senior centers, as well as not just the staff, their volunteers, as well as the participants. Some of those guidelines have been relaxed now that individuals have the option to be vaccinated. So we're still working through a lot of those logistics. Some of our centers have partnered with us to provide registration and transportation services to various vaccination clinics as well. So we're still working through a lot of those logistics. But if I had to guess, I would say the fall might be a great time for some of the centers to begin to reopen.
You're on mute.
That was one of the transportation contracts that are on companies that are on this contract. I know that was one of their main jobs, was to get seniors back and forth to that. But they're still doing other type of services, correct?
Yes, many of our providers for options program are providing medical transportation services, whether it's to and from their physician. Many of them use this service to actually be vaccinated as well. So for the options program, these transportation services are truly for their medical need.
Okay, thank you. Any other questions before we, anything else you, Director Mason or Options Director Mason or Paul Porter you'd like to add? All right, hearing none, we know this is very valuable, as my colleague, Councilman Miller stated. We've, all of us have fought in some way, shape, or form to get the increase for options, so we would not have anybody on a waiting list. I'm sure Councilman Sweeney will work diligently to work on the west side to get those individuals that are probably sitting in their homes, do not know how to access, or too proud to access these services. So I'm sure in his tutelage, he will get that done.
Thank you.
I'd like to call for a vote to pass this contract, and I believe, Paul, you'd like this second reading suspension?
If we could, please, Chairwoman Conwell, that would be great. This one does have a July 1 start date, and I think HHS is working to get ahead of the curve time-wise with getting items into the Enforce system. However, just based on the high number of vendors that we were dealing with, since this is a large contract, it's one that if we could go 3 readings, I'd love to, but that would put us past the 7/1 start date. So if we could get it suspended, that'd be great.
Madam
Okay.
Chair.
One point, Councilman Miller, then. So you said something, Paul, that clicked in my head. So even though it's a master contract, they have to put each of those individual vendors in the M4 system separately?
Correct. Each vendor has their own unique entry in the Infor system because of the specific documents associated with that vendor.
Okay, thank you. Councilman Miller,
Yes, I'll move for approval with recommendation for second reading suspension.
is there a second?
Second, Sweeney.
All right, moved by Miller, seconded by Sweeney. All in favor to move this to the full council under second reading suspension, please say aye.
Aye.
All right, this item has been approved and moved to the full council for second reading suspension. Thank you all for your time and attention today. Madam Clerk, I don't believe there's any miscellaneous business, but if there's any, colleagues, please raise your hand. None. This meeting is adjourned. Thank you.
Thank you, Madam Chair.